Why does stress have such an impact on our health both mentally and physically? The answer lies in the interplay between stress hormones, the nervous system, and various physiological responses. When the body perceives a threat or stressor, the sympathetic nervous system activates the fight-or-flight response, releasing stress hormones like cortisol and adrenaline. While these responses are essential for short-term survival, chronic exposure to stress can lead to a cascade of negative effects on health. Chronic stress's impact on cardiovascular health extends beyond the elevation of blood pressure. The physiological stress response involves the release of stress hormones, particularly cortisol, which can contribute to inflammation and arterial stiffness. Over time, this inflammatory state may lead to atherosclerosis, which is the buildup of plaque in the arteries, further elevating the risk of heart disease and stroke. Additionally, chronic stress can dysregulate the autonomic nervous system, affecting heart rate variability and increasing the likelihood of arrhythmias and other cardiac complications. The connection between stress and weakened immune function is well established. Chronic stress can alter the balance of immune cells and decrease the production of immune signaling molecules. Research suggests that stress-induced glucocorticoids, such as cortisol, may interfere with the function of immune cells, impairing the body's ability to mount an effective immune response against pathogens. This weakened immune system response leaves individuals more vulnerable to infections with implications for both acute illnesses and chronic conditions. The relationship between chronic stress and mental health disorders, specifically anxiety and depression, involves intricate neurobiological changes. Prolonged stress activates the HPA axis, leading to increased cortisol levels. Elevated cortisol can adversely affect the structure and function of the hippocampus and prefrontal cortex, brain regions critical for mood regulation and emotional resilience. The chronic activation of stress pathways may contribute to the development and worsening of anxiety and depression. Stress's impact on the gastrointestinal system is multifaceted. The gut-brain axis, a bidirectional communication system between the gut and the brain, plays an important role. Stress can alter gut motility, increase visceral sensitivity, and contribute to inflammation in the GI tract, all of which are implicated in conditions like irritable bowel syndrome. Additionally, stress may influence the composition of gut microbiota, potentially contributing to GI disorders and dysregulation. The relationship between stress and weight gain involves complex behavioral and physiological mechanisms. Stress can lead to dysregulated eating patterns, with some individuals turning to comfort foods high in sugars and fats as a coping mechanism. The hormonal stress response involves the release of cortisol, which can stimulate appetite and promote the storage of fat, particularly in the abdominal region. These factors contribute to overeating and the development of obesity over time. Stress-induced disruptions in sleep are mediated by changes in neurotransmitters and neurohormones. Stress activates the arousal centers in the brain, making it difficult to initiate or maintain sleep. Increased levels of cortisol, along with alterations in melatonin production, can contribute to insomnia. Sleep disturbances, in turn, exacerbate the effects of stress, creating a vicious cycle with implications for overall health and well-being. The physical manifestation of stress in the form of muscle tension is a common experience. Stress-induced muscle tension can lead to headaches and migraines due to the constriction of blood vessels in the head and neck. Additionally, chronic muscle tension contributes to general body pain, particularly in the shoulders, neck, and back. Relaxation techniques, exercise, and massage are often recommended to alleviate musculoskeletal symptoms associated with stress. Stress's impact on reproductive health extends to both menstrual irregularities and fertility issues. Stress can disrupt the delicate balance of reproductive hormones, leading to changes in the menstrual cycle, including irregular periods or even amenorrhea in extreme cases. In terms of fertility, stress may affect the release of reproductive hormones, impacting ovulation in women and sperm production in men, thereby reducing the likelihood of conception. The skin, being a responsive organ to stress, often reflects internal turmoil. Stress can exacerbate skin conditions such as acne and psoriasis through multiple pathways. Stress-induced hormonal fluctuations, inflammation, and alterations in sebum production contribute to the development and worsening of acne. In the case of psoriasis, stress can trigger flare-ups through immune system dysregulation and the release of pro-inflammatory cytokines. Chronic stress's impact on cognitive function involves changes in brain structure and function. High and sustained levels of cortisol, as seen in chronic stress, can lead to atrophy of the hippocampus, a brain region crucial for memory formation and spatial navigation. Additionally, stress-induced alterations in neurotransmitter systems, such as reduced levels of dopamine and serotonin, contribute to difficulties with concentration, attention, and memory. Stress can exacerbate respiratory conditions, particularly asthma. The relationship between stress and asthma involves complex interactions, including the release of stress hormones and the activation of immune cells in the airways. Stress-induced changes in breathing patterns and increased airway inflammation can contribute to the worsening of asthma symptoms. Managing stress is an essential component of comprehensive asthma care. The increased risk of substance abuse in response to stress underscores the role of maladaptive coping mechanisms. Individuals facing chronic stress may turn to substances such as alcohol, drugs, or tobacco as a way to self-medicate and temporarily escape from stressors. The cycle of substance use as a coping strategy further compounds the negative impact on mental and physical health, creating a challenging cycle to break. To summarize, the diverse effects of stress on various aspects of health emphasize the importance of stress management strategies for overall well-being. The interconnectedness of physiological and psychological responses to stress underscores the need for holistic approaches that address both the root causes of stress and its downstream effects on the body and mind. Integrating lifestyle changes, therapeutic interventions, and social support can contribute to resilience and better health outcomes in the face of stress. Thank you for watching. If you would like to support us, subscribe now to stay updated on the latest videos, insightful discussions, and exciting content. Don't miss out on the fun. Hit that subscribe button and engage with us to be a part of the conversation. Your voice matters, and we can't wait to share this journey with you.